Hello, my name is Muhammad Rikwan and I'm going to explain about heart. So, what is heart? Heart is a main organ of your cardiovascular system, a network of blood vessels that pump blood throughout your body. It also works with other body systems to control your heart rate and blood pressure. The heart is a fist-sized organ that pumps blood throughout your body. It's the primary organ of your circulatory system. Your heart contains 4 main section chambers made of muscle and powered by electrical impulse. Your brain and nervous system direct your heart function. So the following diagram show the inside of your heart. So right here, you can see there's a right atrium, left atrium, right ventricle, and left ventricle. And then we have a tricuspid valve, which is closed, and pulmonary valve, which is open. Then at the top we have a vena cava, aorta, and pulmonary artery. Inside we have a aortic valve, which is open, and mitral valve, which is closed. And also we have septum in the middle of the heart. So the diagram show the outside of the heart. So we have so at the top, similar tadi, we have a vena cava, aorta, and pulmonary artery. So the first one, first one is left coronary artery. It divided into 2 branches, the circumflex artery and the anterior descending artery. And then we have right coronary artery, RCA. It supplies blood to the right atrium, right ventricle, bottom portion of the left ventricle, and back of the septum. And third one, we have circumflex artery. It supplies blood to the left atrium and the side and back of the left ventricle. Then we have coronary veins in blue. It brings blood back to the heart from other part of the body. And the last one is left anterior descending artery, left. It supplies blood to the front and bottom of the left ventricle and the front of septum. That's all from me.
We have coronary artery disease, but sometimes also known as CAD. The heart disease also can make blockage in your coronary arteries and the vessel that supply blood to your heart. It also can lead to a decrease in the flow of blood to your heart muscle, keeping it from getting the oxygen it needs. It also can give you pain in your chest or lead to a heart attack. The example or other heart disease is heart failure, heart valve disease, pericardial disease, cardiomyopathy is also known as heart muscle disease, and lastly, it has congenital heart disease.
There are several factors that play important roles determining whether you are not likely to develop a heart disease. 2 of these factors are age and heredity. Your risk could be a lot more greater if you have a family member that has a history of heart disease. Some studies have shown that people with depression develop heart disease at a higher rate than the general population. This would happen when the plaque develop in the arteries and blood vessels that lead to your heart. This would block all the important nutrients and oxygen from entering your heart.
How to prevent heart disease? Number 1. Stop or giving up smoking. Effect: smoking increases the formation of plaque in blood vessels. Coronary heart disease occurs when arteries that carry blood to the heart muscles are narrowed by plaque or blocked by clots. Number 2. Exercise regularly. Effect: people who exercise regularly have a low risk of developing many long-term, chronic conditions such as heart disease and type 2 diabetes, stroke, and some cancer. Number 3. Get enough sleep. Get enough sleep will help to lower your risk for serious health problems like heart disease, and it reduces stress and improve your mood. Number 4. Do regular health checks. Do regular checkup will help you to detect potential life-threatening health condition or disease early, increase chances for treatment and cure.